Uh, Good afternoon, learners.
Good afternoon.
So we'll start the session. I think let the people to join. I was trying to share the screen of the PPT, but I think it is not. I'm unable to do so. So I'll share the PPT with you later on. Just wait for 2 minutes. I'm trying to share the PPT. If it is not possible, then I'll share at the end of the session. I'll take the class without seeing the PPT. Okay, as the PPT is not, I'm not able to share the PPT. At the end of the class, I'll give you the PPT. So today we'll start the class. Before starting the session, I would like to tell you few things. You don't ask any question. If you have any doubts, you just keep in writing. And at the end of class, it will not disturb the students. It will not disturb other students. Okay. Is my voice audible to all of you?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, okay. If you have any problem, you tell me. So the basics of critical care nursing, as you know, we know we'll get patients for critical care unit. The patients who are treated only in critical care unit. That is not only the patients we get. And the who are the critically ill patient? I think you must have been told yesterday class. And all of you know the patients who are having complications with disease condition and in a life-threatening situation, they can be placed in any area. Not only in ICU, CCU, you will get the critically ill patient in every ward, even in NICU, PICU, and all other care unit. Critical care unit, intensive care unit, you will get such patients. So, as we know, the critical ill patients are the patients who are having a comorbid condition with a disease condition and in a life-threatening situation. So, today we'll be discussing about the renal transplantation. So, first of all, we need to know why the renal transplantation is required and for whom will think of renal transplantation. So before the in this session, you will be learning about we'll review the basic anatomy and physiology of kidney and the concept of ESRD, that is end stage renal disease. Then we'll be discussing about the definition, indication, and contraindication of kidney transplantation and how we manage the end stage renal disease with perioperative nursing care. What is perioperative nursing care? Anybody? Can unmute and tell Anvesha? Anvesha can tell me what is perioperative nursing? Perioperative nursing.
Ma'am, perioperative nursing means before of OT. For-
What? Pardon?
Hello, ma'am.
Huh.
Perioperative means before OT. How I care patient.
No,
Which
not before OT only. Who can tell? Olami.
I'm during the
During
surgery.
OT, ma'am.
What is perioperative? I am asking, not pre.
Ma'am,
During
perioperative
surgery.
means
ma'am,
preoperative, intraoperative, and postoperative.
postoperative.
Very good.
So,
Perioperative is preoperative, intraoperative, and postoperative nursing care. So we'll go with that. Perioperative nursing care will be learning in this renal transplantation. So the basic review of anatomy and physiology of kidney. Uh, uh, the review of anatomy and physiology, as you know, kidney is located posterior aspect of abdomen and it lies between the 12th thoracic and 3rd lumbar vertebra. And each kidney has three major parts. What are they? Anybody who can speak? Who can tell about what are the major parts of the kidney?
Cortex, medulla,
Medulla
and
cortex.
pelvis.
Pelvis. Very good. Cortex, medulla, and pelvis. Then the functional unit of kidney is called
Nephron.
Nephron.
nephron. Very good. Each kidney contains more than 1 million nephron, as you know. So nephron is a microscopic structure consisting of glomerulus capsule and tubular system that we all know, and empty into the renal pelvis and the ureter, then to bladder and urethra. In continuation. Then the function of the kidney. So the function of the kidney, we know, excretion of nitrogenous waste products, maintenance of water balance of the body, regulation of acid-base balance and electrolyte balance of the body, excretion of drugs, poisons and unwanted chemicals from the body, then regulation of blood pressure of the body, then erythropoiesis, making active vitamin D, which is necessary for the bone. That is also the function of the kidney. Then other than that, the urine is which is formed by the nephron, that is followed three processes, that is filtration, reabsorption and secretion. All that we know. Only I'm just reviewing the function of the kidney. So filtration is the passage of liquid through a filtering membrane as a result of pressure differential. Then reabsorption takes back fluid and other substances through body tissues, and secretion involves the active transport of certain chemicals from the bloodstream into the tubules. Then the body regulates the fluid and electrolyte balance with these processes. Kidney also maintains acid-base balance by excreting phosphoric keturic acid and sulfuric acid as they are formed. In the presence of acid-base imbalances, kidney excrete either hydrogen or bicarbonate ions to restore balance. Then kidneys also produce renin, which helps in blood pressure regulation. This is all about the anatomy and physiology. This is the brief review of kidney function and structural aspect of kidney. So what is kidney transplantation? If you will go to the kidney transplantation is a surgical procedure to remove a healthy functioning kidney from a living or brain dead donor and implant it into a patient with non-functioning kidneys. So there will be one donor and one recipient in this surgery. So donor can be a living person as well as a brain dead person. So we usually call that living donor or cadaver donor. Brain dead, patient, brain dead kidney. In those cases, when you get kidney, we call cadaver donor. So what are the indications? Indications, that is in case of end stage renal diseases where the renal function is not up to the mark. Then if any trauma is there to the kidney or any injury, the kidney has been damaged by the injury, then we'll go for kidney transplantation. So what are the contraindications for renal transplantation? One is life expectancy of less than 1 year. If that is there, you will not go for renal transplantation. If the patient has recent malignancy, also we will not go for transplantation. If the patient has active infection, will not go. Then HIV infection, chronic untreated infection, uncontrolled psychiatric disorders that impair the ability to informed consent to adhere to the treatment regimen, active substance abuse, then ABO blood group mismatch, then severe or uncorrectable coronary disease, peripheral vascular disease, pulmonary disease, cardiomyopathy. In all these cases, all these cases conditions are contraindicated for renal transplantation. Okay. So why it is kidney transplantation is required and what is the advantage of renal transplantation? Renal transplantation patients develop many physiological changes. If you will do the renal transplantation and it is supported by the body of the recipient, then the survival rate will be high. So this renal transplantation, which causes many physiological changes related to renal failure as compared with the dialysis. Dialysis is a hectic procedure. So to get rid of dialysis, the kidney transplantation can be done. There is a reversal of physiological changes caused due to renal failure. So that is why renal failure transplantation can be done. Then there will be higher survival rate. Patients who undergo kidney transplantation survive longer than those patients who are on periodic dialysis. Then they can have a better quality of life. The patient with renal transplantation have better quality of life and are able to live a more independent life because they don't have to receive periodic dialysis. Then fewer dietary restriction will be there. So the patient, not many, so the patient with renal transplantation having fewer dietary restriction can survive for a long period. It is not too costly. Also, this is very nowadays kidney transplantation can occur in many government hospitals, so it is also cost effective. It is actually less costly than the long term dialysis treatment because only a donor is needed for that, and rest of the precautions, everything the patient will follow, and the patient can survive for a longer period. So before renal kidney transplantation, you have to assess different comorbid conditions. So comorbid conditions like obesity, you have to assess the diabetes, cardiovascular diseases, if the patient is suffering from any infections or not. Then you have to assess the immunologic evaluation of transplant recipients. There are three categories of immunologic evaluation in selection of appropriate donor or in determining the prognosis of transplant patients. So first, the blood grouping typing and cross matching you have to do. Then serum screening that you have to do, and then typing and antigen matching, that is also important. That is HLA linked test you have to do for tissue acceptance. Then the goal of typing and matching histocompatibility antigen between the recipient and donor is very very important. It should be done to minimize the number of incompatibility present by the graft, and thus to decrease the likelihood of rejection. So once the kidney is transplanted, if it will be rejected by the body of the recipient, then the surgery will be of no use. So that is why it is very important to get this immunological evaluation properly should be done before the transplantation. So serum screening and cross matching, as I said, the recipient and donor human leukocyte antigen, that is HLA, cross match is very important between the donor and recipient. So that is 6 antigens which is common are considered a perfect match. So HLA which is received 6 antigens, 3 from the one of the parent and 3 from other parent. I mean from father and mother it has come. So that has to be cross matched. The cross matching permits the clinicians to determine whether they are pre-existing antibodies against the donor histocompatibility antigen, that is ABO matching. As you know, we have all 4 blood group, that is A, B, O and AB. So that matching is very very important before this transplantation. If the natural antibodies against A and B blood group can bind the vascular endothelial cells which express these antigens, and that can be assessed beforehand whether it is matching to the both the donor and the recipient, that has to be tested. Then cellular assay, the tissue which we are taking, that is a HLA with the human leukocyte antigen, that has to be assayed between the that HLA human leukocyte antigen test should be done between the donor and recipient to know the tissue matching between the donor and the recipient. Then classification of the donors. So donors can be classified in 3 groups. One is related living donor. Who can say who is the related living donor? You people are working in critical care unit. Who are being called the related living donor?
Sibling,
Sibling.
father, mother.
Then father or mother is the best possible source of kidney donor who match the patient closely. Then cadaveric donors. Cadaveric donor, as I said, a clinically brain dead person who is less than 65 years and free of systemic disease, malignancy, and or infection can also be a suitable donor. Then other living donors besides the siblings and parents or father and mother, other living donor can be spouse and relatives like cousin, aunt, uncle, friend, which is matched with those 6 antigens and the cellular assay which matches to the patient, that can be done. So what is the eligibility or requisite for a donor? Any idea? What are the requisites for donor? Anybody who is working in a critical care unit can speak. Donor must have what? To whom you will call an eligible donor? Donor must have normal renal function of both the kidneys, isn't it?
Yeah,
So
ma'am.
no malignant
Yes, ma'am.
disease, and the donor should not suffer from any malignant disease or any generalized infections or any
Ma'am, first of all, consent. First of all, he or she will agree to donate the kidneys.
Pardon?
Ma'am, first of all, donor have to he or she have will means donate the kidney.
It's not audible. Can you write in the chat box?
Madam, he is saying the donor's consent is important first.
Yes. No, I'm just saying who is the eligible one. Then we'll go for the consent and all. We are not taking now. Who is a eligible donor? What requisite is he or she must have, that we are just looking for. Then we'll go before the renal transplantation. Consent is must, that will take, that will say later on. Okay. So, donor must have normal renal function of both kidneys. We have not decided to whom we are taking as donor. Consent will be taken before we'll go for the surgery. So, donor, now what are the eligibility criteria for a donor that we are discussing? So, donor must have normal renal function of both kidneys. Then, donor must not suffer from any malignant disease or generalized infection or any abdominal trauma or renal trauma. Then donor must have negative hepatitis B antigen. All routine tests you have to do for the donor and as well as for the recipient. And donor should have the negative HIV antibody. That means not suffering from HIV, not suffering from hepatitis B infection. Then donor must have no problem in ventilation, respiration, and or cardiac rhythm. So must have a healthy cardiovascular system and respiratory system. No lesion, no pathogens should be there. Donor must have normal blood pressure. Then donor must have excellent health with two properly functioning kidneys. So the kidney should, function up to the in optimum level. So that is what normal functioning and to the optimum level. Then serum for ABO blood group, tissue specific antigen, that is a human leukocyte antigen. Suitability will see if it matches, then can the donor give to the recipient. Then then the histocompatibility will be done by mixing the lymphatic synthetic culture index. That will be done, and seeing that all the tissue, blood, everything matches to the recipient. Then the donor must be in complete emotional well-being. So next part comes, whom will select as donor with all these eligibility criteria, and how will counsel, because that's our prime responsibility being nurses. So to give counseling and to prepare the donor mentally and to take the written consent, not in only written consent, it is informed consent. So that the we have to take from the donor. If the what is informed consent? Anybody? Anybody who can speak? Please unmute. Arun Kumar, please unmute and tell what is
Madam, you should
informed
explain.
consent.
Madam, you should explain about the surgery and the risk involved and
Yeah, it's the
complication.
authorization which is given by the patient to do any sort of procedure on his or her body. And before that, you have to tell all the risks and benefits involved in the treatment procedure. So that is why it is called informed consent. And informed consent will be valid when the person is a major, that means more than 18 years old, and then 21 years old now for the males. So you have to tell the person that it will be given in writing, and he is agreed to all the benefits and risks involved in the procedure. So the informed consent is valid when you take in written form, and you have not done any coercion, compulsion to the patient. You have explained everything about the risks and benefits involved in the procedure, and also the patient is having sound mind, not mentally ill, and a person is major. In case of minor, parents will give the consent. So that is called informed consent. So then complete understanding of the patient about the donation process and outcome is necessary. That is what, when you just explain the patient for the donation of the kidney, you have to explain all the pros and cons involved in donating, and the risks and benefits of his or her own health, and as well as the patient health. That you have to explain everything to the donor. And what will be the outcome? What precautions the donor has to follow? Everything you have to explain to the patient. So in case of cadaver donation, can you say from a cadaver how long you can keep a kidney for the transplantation, or within what limit of time you will transplant the kidney of a cadaver? Anybody who has any idea about that? Any idea for organ donation? So in case of kidney donation from a cadaver, you can use the kidney of a cadaver from 6 to 30 hours within that. So, how will I evaluate the cadaver donors? As I said, you in case of donor, living donor, you have to take the consent of the donor, informed consent. That is, I told, and that you have to explain everything to the donor, the risks and benefits involved in that, and you will take the consent of the patient if he is or she is a major. But here in the cadaver donor, you have to take the consent of the family members. So cadaver donors evaluation, you have to identify who can be a potential cadaver donor. So as the other conditions are same to the cadaver, like not having malignancy, not having active infection, not having any infection like HVSG, HIV, all that. That is also in that a person, brain dead person, that does the mandatory requirements. Then the person who has established brain death, and you have to obtain the consent from the family. Then you have to prepare the cadaver donor with appropriate hemodynamic and respiratory support, maintain the stable electrolyte balance and urine output, obtain medical history to rule out high risk illnesses. As I said, all the other eligibility criteria you have to check. Then screen the laboratory reports, blood type, HLA screening, complete blood count report, serum chemistry, blood sputum, urine culture, urine analysis, chest X-ray of that cadaver, patient. That report you have to see, viral serology, everything you have to check. Then administer preoperative antibiotics and salmeterol. Then repeat blood sputum, urine culture from each ureter and the bladder. Then harvest the kidney. What is the kidney harvesting? We will learn. So cadaver donor harvesting and preservation, that is the donor kidneys are obtained through a block, that is nephroureterectomy. See, you have to do the renal transplantation. You can do bilateral nephrectomy, or you can do the um, even unilateral. So it depends upon the condition or functioning of the kidney of the recipient. So the donor kidneys are obtained from the cadaver through a block of nephroureterectomy, including a segment of aorta and inferior vena cava. Before cross-matching, aorta is cannulated and organs flashed with a preservative solution, that is University of Wisconsin solution, that is given. The harvest is then completed and organs stored in cold ice bath, virtually eliminating warm ischemia. What is warm ischemia? Warm ischemia refers to the period between donor asystole or lack of blood flow to the kidneys and the beginning of cold storage. So that is the period that is warm ischemia occurs. Then cold ischemia refers to the time in cold storage or machine perfusion. So warm ischemia for longer than 20 minutes and cold ischemia longer than 24 hours are associated with increased risk for delayed graft function. So the graft functioning may be late. So that is why within these hours we have to do the transplantation. In the process of harvesting cadaver kidney, the cadaver kidney is flushed with a cold intracellular solution and placed in an ice bath for storage until transplantation. The time of ice bath varies. It depends upon the condition of the kidney. So coming to the live organ donor. So what you will do for the live organ donor evaluation? So first of all, you have to identify the donor in the family. If any family member is interested, and you have to do the donor. You have to give appointment to the donors with the nephrologist. So they will get the complete history and physical examination of the donor, and they will take consent of the donor. Then they will check all the blood type and HLA determination, screening for lab analysis. So all the family members, they will go for all these, which blood type and HLA matches to the recipient, she or he can be called as donor, and he or she will be counseled after that, and consent will be taken after that. So you have to see the viral serology by testing for hepatitis B virus, hepatitis C virus, cytomegalovirus, prothrombin time, glucose tolerance test, if whether patient is diabetic or not. All the tests, regular testing, pregnancy testing if he is a female, then urine analysis, uh, uh, doing the culture sensitivity for 2 times. Then you have to check the 24 hours urine collection for protein creatinine excretion also for 2 times. Then do the SCG and chest X-ray. All details. Thorough evaluation of the patient you have to do. Donor evaluation. Then you have to do the pulmonary function test, intravenous spyelogram, arteriogram. Then repeat the cross match before the donation. Then leaving unrelated donors become a major source of organ for kidney transplantation. Maybe the donors are not related to you, but since today nowadays we are having nuclear family and very less number of joint family, you'll see you may not get the donors from the family. You may get from outside also, other living donors you can find out. So the graft survival rate of spouse donor was superior than that of cadaver donors and identical to living related or halotype donor. So you have to choose the donor which matches the tissue, and the abiotype matches occur. No incompatibilities occur with the recipient. Now we'll go for the surgery. Before the surgery, what you will do? As you said very rightly, you will take the consent, informed consent, and you will evaluate all the investigation you will do. Even in every step of kidney transplantation for the donor as well as for the recipient. So then you have to counsel, make the patient mind ready to receive the kidney, and also you have to counsel through the donor. Thoroughly that what precautions he will follow after donating the kidney, and you will prepare mentally, emotionally accepted to the donor that he or she is going to donate a kidney or donate the kidney. Then what is the transplant surgery? In that, the potential recipient must be evaluated for operative suitability. See, only donor evaluation is not important. The recipient evaluation is also very, very important. So the recipient must have the capacity to receive. So the condition must be suitable to receive the kidney from from other person, because the recipient body will accept the new kidney as a foreign body. So that is the main thing. So you have to prepare both way, to the donor and the recipient. So this transplant surgery includes immediate management of volume status and electrolyte abnormalities, like what we do, the dialysis of the patient, the recipient, and you will search to find out. You will evaluate the patient whether the recipient is suffering from any active infection like UTI, urinary tract infection, peritonitis, or associated peritonitis. Why it will be there? If there is any peritoneal catheter is there, then you have to find out whether any infection is there or not, suffering from any infection or not. Then or any evidence of coronary ischemia. So you have to see the status of recipient. That is the cardiovascular status of the recipient is optimum. Then you will just go for the transplant surgery. So before operation, the patient needs to be re-examined repeatedly. A thorough preoperative medical evaluation should be done to screen for any illness. So what sort of illness the recipient is suffering from, that you also has to see. No current infection the patient is suffering from, you have to check. Then it is also advantageous to dialyze. Please mute your please mute the mic. Someone, I can't read your name. Please mute. Okay. So before operation, the patients need to be re-examined, as I said. So it is advantageous to dialyze the patient within 12 hours of the transplant surgery to optimize the volume status and to correct any electrolyte imbalance if it is there. So before surgery, within the 12 hours, you have to do a dialysis to the recipient. The surgery usually takes 3 hours. The donated kidney is usually implanted in the right or left lower quadrant of the recipient, as the damage of the kidney in left or right, whatever it is there in the recipient region. Then the incision is given like a hockey stick, extending from iliac crest to the symphysis pubis. So this is the way the transplant surgery is done. What is our role as being nurses in this renal transplantation? We'll be discussing that. So as in the pre-operative management, what we'll do in the pre-operative management? So you have to collaborate with any agency who is giving. I mean, if we were bringing the kidney from other agency or my other persons, so you have to find out the organ procurement agency who is giving kidney, or the you have to coordinate with the other team, the surgical team, and you have to just ensure it should be the kidney has to be implanted within the time, as I said, the limit immediately for a successful grafting. So you have then the what is your role in the preoperative management? Prepare the patient for dialysis, and before surgery, as I said, within 12 hours you have to do dialysis to correct the electrolyte balance. Then depending and maintain the volume status. So that you have to do. Then maintaining the patient as NPO, that is nothing by mouth, to help the patient to minimize the nausea and vomiting during the post-op or immediate post-op period. Immediate post-op period or intraoperative period, because it will cause, if there will be vomiting immediate post-op period or recovery period, what will happen?
Infection.
Arun Kumar?
Vomiting.
Aspirate. Patient can aspirate and there will be aspiration pneumonia, and that may be inevitable in that cases. So to avoid this immediate post-operative and intraoperative aspiration, you have to keep the patient by in NPO. So to minimize nausea and vomiting. So performing a thorough nursing assessment, what you will do in the thorough nursing assessment, you will check the vital signs and weight should be documented for later comparison, and the extremity pulses should be assessed. You will have to check the peripheral perfusion, transfusion, which is better or not, and need to be documented for later comparison. Then review the current medical history of the patient and implement the orders like delivering appropriate medication administration as per the protocol. So usually the patient recipient is given immunosuppressive coverage. Patient is kept, recipient is kept under immunosuppressive coverage and antibiotic coverage pre-operatively. Why? Why immunosuppressive?
যাতে reject not
The rejection rate will be less, and the So if you will make the immune system dull, it will not be aggressive to reject the the kidney of other patient, so other individual. That shows the patient will accept the kidney as his or her own organ. So you have to suppress the immune system by giving immunosuppressive drugs. Then obtain the blood test to make sure that the patient has electrolytes within the normal limits. You have to check repeatedly the all the electrolytes of the patient should remain within the normal limits and no infection should be there. So it's ESR, everything should become as normal in the test, and you must have done the appropriate cross match of the organ donation. And then electrocardiogram, that is ECG, chest X-ray, everything you have to do and forward to the results to the surgical team. See, it's a teamwork. It is not the only surgeon is involved in the procedure. So that means it's a whole team collaborating with other team department doctors. The transplantation is done. So once you get the once you obtain the vascular access, and you have to prepare the skin before sending the patient to the OT, and clean the surgical clipping will be done in the surgical area, surgical site. So you have to check being the responsible or first hand caretaker, or you have to check the investigation report for the recipient. So both the donor and recipient investigation you have to check. Both the donor and recipient and to undergo an in-depth reassessment, and several investigations should be carried on before the transplant surgery. That is urine analysis, again routine microscopic 24 hours urine test will be done for creatinine blood test. And then HLA you have to do the testing of that. Then renal ultrasound you have to do. Then vital signs assessment studies you have to make. Kidney biopsy, intravenous spyelogram, renal arteriogram. Besides all these tests, you have to just make the patient comfortable, both the donor and the recipient, because you have to lessen the anxiety level of the patient donor, and the calm and coolness need to be harbor, the donor mind should harbor, so that the mentally the donor should be remain calm. Then before taking the patient to the OT, you have to just ensure that fumigation must have done, because after renal transplantation, everywhere you have to maintain the field of sterility. So preparation of the room should be done. Then OT is to be fumigated by 2% basil acid. Then verify the histocompatibility test of if it is identical twin or family member uh, or any other living donor. Then administer immunosuppressive medication to recipient as prescribed for 2 days before transplantation. Then maintain protective isolation. This is very important. And after the surgery also, you have to follow barrier nursing. This is isolation nursing is very important, because you want to restrict visitors and restrict the infection rate. So for that is not to inoculate any infection to the patient. You have to follow this protective isolation, protective zone for to that. You have to keep the patient in those areas. Then verify that hemodialysis of the recipient is completed 24 hours before the transplantation. Ensure that the patient is also free from any infection. As I said, all these criteria, that means having no current infection, not suffering from HPSAG, I mean hepatitis B virus, HPSAG is negative, then HIV is negative. The patient is not suffering from HIV or any other infection. So that you have to ensure first. Then again you have to do the renal function test, that is blood urea nitrogen, urea creatinine, all that you have to check. Then encourage the discussion of feelings of both donor and recipient. You have to have a very cool and calm mind, and you should not show any sort of aggression to the patient. Even you do lot of work, you have to counsel and give always a smiling face, and you just ensure that what the feelings the patient, you need to be very empathetic. Whatever the queries they have, the donor and the recipient, you have to uh, you have to clarify them, because you are only the source of information for them, and they think, as you are the first hand caretaker, they think immediate, whatever they will ask, you will give answer to them. So you have to explore all the feelings, as you are responsible not only to look after the physical health of the patient, you have to see the psychological health of the patient as well as spiritual health. So you need to explore what the feelings and anxiety the patient is having. So you will give, take all opportunity. You will take all opportunity to explain, to the clarify the glory of the patient, or both donor and the recipient, and then you have to encourage always the discussion if they want, because their feelings, their anxiety need to be come to the surface, and they should be explained properly, so that the patient, the donor as well as recipient will maintain a serene and sound mental health during the transplant surgery. So now come to the post operative management. So what will the intraoperative management you will do? What are the intraoperative management you will do? Anybody who can speak? Anvesha?
Vital monitoring.
Mamta, you tell.
Ma'am, vital monitoring.
Vital monitoring during the operation, then
Aseptic technique.
adopting all sterile field you have to maintain, then
Ma'am, anesthetic checkup.
anesthetic checkup you have to, that is the prior to operation.
Ma'am, IV fluids during
Pardon?
surgery. IV fluids.
IV fluids need to be maintained. Maintain the volume status throughout. Then be speculative whether the patient is bleeding profusely or not. Okay, and also you have to keep watch that whatever the instruments are used, they have to keep properly, otherwise you can lift anything inside the abdomen. See that everything is, you have to count repeatedly. All these nursing activities you will do, and ensure that the patient is having that means normal vital signs, that throughout the operation, that you have to check. So we'll come to the post-operative management. After renal transplantation, as we know, you have to be there for 24 hours. So the nurses should be available in the, as these are the very vital and life-threatening situation during the transplantation surgery. The patient care should be 1:1. So they should be kept in ICU, and you may keep other life-threatening patients in wards, but After surgery, it is important to take the patient to the ICU, and you have to we have to be available. That means nurses need to be available at the bedside of the patient in 24/7 for a close monitoring. As I said, you have to see whether the patient is feeling nausea, vomiting, because immediate post-operative vomiting can be very fatal, and also if the patient during intraoperative also there should not be no nausea, vomiting. So that should be there. You have to closely monitor that. Then reverse the barrier nursing. As I said, during post-operative care, barrier nursing is important. You have to restrict the visitors to that area where the transplant patients are, in ICU. That is purely restricted, and the doctors or nurses, all healthcare providers were entering into the uh, ICU. They should be with proper dress and with all uh, everywhere you need to maintain sterile field. Sterile gowns, everything they will wear properly. All healthcare providers. Then remember, as kidney begins to function immediately, uh, or it may delay for few hours. As I said, it depends whether the kidney is from a cadaver donor. It takes little bit time. But in case of living donor, it can function immediately also. So hemodialysis is performed until adequate kidney function is established. That should be done. Monitoring of vital signs is very, very crucial. So in the first post-operative hour, the vital signs are recorded every 15 minutes. So that is the importance of this kind of patients, and you should remain at bedside and record the vital signs at every 15 minutes interval. In the next 2 hours, this is 3 to 4 hours of surgery. It is recorded every half an hour and then 1 hourly. After fourth 4 hours, you have to record it 1 hourly. So the vital signs still need to be recorded as per the schedule, as I said. Then monitoring intake output is done hourly. Monitoring of IV fluids closely to be done for fluid overload. As you know, the signs of fluid overload and signs of fluid deficit is there, but here it is important. If there will be fluid overload, then immediately there can be fatal consequences to the patient. Then monitoring of daily lab studies, urine for specific gravity, that is 24-hour urine collection you will do for assessing the specific gravity. Then blood studies, then a daily weight you have to check to see the hypovolemia, or that is uh, risk for fluid volume deficit or risk for blood volume overload. That two things you have to monitor. Then pulse oximetry you have to do, blood urea nitrogen you have to check, and creatinine level also you need to measure accurately um, every day. Then maintain the patient in semi-fowler position is desirable. It is important to note that the urine is pink and bloody initially, but gradually it returns to the normal within several days to weeks. Within a week, it can come to the normal. So you should give counseling to the patient the patient as well as the patient attendant. Monitoring for gross hematuria and clots are important, which are not expected and needs to be notified immediately to the surgeon. If there is a gross hematuria or you are getting clots in the urine also, immediately you will notify to the surgeon, and they will take measures to prevent clot formation. The Foley's catheter should be removed as soon as possible to prevent the infection. Then maintain protective isolation, precaution, and monitor the infection. As I said, the type of shoe, everything, all PP, everyone should wear and enter to the patient, because those areas need to be highly restricted, and patients should be completely isolated, and sterile field need to be maintained everywhere. So the reverse barrier nursing should be needed, should be maintained. Monitor bowel sounds and initiate a diet as prescribed when bowel sound return. As you know, after due to anesthetic effect, would be paralytic alias. So that can, so when the intestine function returns after effect of the from the anesthesia, when the bowel sound is hard, then you have to give the or prescribe the diet. So also you will tell the patient to maintain good oral hygiene, at least frequently. The patient can, if can, do the oral brushing and all, because that infection in the mouth, it can lead a secondary infection to that. So to avoid infection repeatedly, the oral hygiene also need to be maintained, and the oral cavity should be monitored for any type of stomatitis, bacterial or fungal infection. That also has to be inspected, examined daily. Encourage deep breathing and coughing exercise also to the patient. Then all staffs need to maintain strict and aseptic technique. As I said, while doing dressing, even while entering to the patient area, everybody has to strictly follow. No deviation should occur. Strictly follow the restriction for the no. Other persons, other healthcare provider, entry of the other healthcare providers should be allowed. Then administer medications as prescribed, which may include antifungal, antibiotic, immunosuppressive agents, and corticosteroids. So steroids as to reduce, suppress the immune activity or immune system of the recipient. Then continuous assessment for organ rejection is important by monitoring. What are the signs of rejection? Anybody can tell?
Fluid overload.
Pardon? Anisha?
Fluid overload and
Fever.
Yes, but you'll just check for fever. If there is fever, it means there is, any type
Infection.
of infection is there. So monitor for fever, malaise, patient is complaining of, or in case of raised WBC, then those are the indications of infection. So that is not at all healthy to see. Okay. So promote a healthy life donor and recipient relationship uh, before the transplant surgery, and as well as the uh, after the transplant surgery. That is a mandate of nursing activity you have to do. Then monitoring is required to assess the patient and recipient for depression. So this is both way. As I said, you have to maintain or counsel the donor. The donor may go to the mental sickness or depression, having only one functioning kidney, and the recipient also may go for the depression and go for the mental illness. That one already kidney is damaged and received a the functioning kidney from others, whether that will, as he is not sure of whether that kidney will function properly or not, then the depression may occur. So it is very important for the nurses to counsel the both the donor and the recipient as well, regularly, periodically, and seeing their mental status. That is important. So, what will health education you will give, and home care you will advise for the renal transplanted patients? So, we'll tell the patient to avoid prolonged period of sitting, Then you'll just counsel the patient to recognize the signs, symptoms of infection and rejection. So you'll just tell the patient if any fever, any sort of infection or anything, bleeding or swelling, anything it occurs, the patient should immediately rush to the hospital. So avoid contact sports in which the kidney may be injured. Then avoid exposure to people with infection. So you'll tell the patient to use always mask going to the crowd outside. Tell the patient to remain mostly, isolated. Even the room should be clean where the patient is residing. Those things also you will give advice to the patient. Then you'll tell the patient to remain adhered to the medication. So it's a lifelong medication the patient has to take, that has to be changed periodically as per the doctor's advice. And the immunosuppressive therapy has to be maintained because for lifelong, so that has to be seen. So even the patient in the workplace, in the home, the patient has to remain same way in the hygienic maintenance of hygiene in the home environment. Even in the safe drinking water, the patient has to take. The patient should avoid raw things which can the infection can go inside. So raw diet, fruits and all diets. So in the restricted diet, the patient only in dietary restriction there will be a restriction of sodium and calories. So the weight also need to be maintained. Uh, then excess protein should be avoided, and because excess protein if the patient will take, there will be excess formation of the waste product. So that will be a load to the kidney. So to reduce the protein excess protein intake and also calorie intake. Then tell the patient to maintain the weight and record and report the weight gain and weight loss also. If more than half and half to 1 kg within a period of few days or week, if it is that, then the patient has to record it and report to the physician and the doctor. Then daily intake output chart to be maintained. So these are all things you have to advise to the patient, how the patient will go to the home and home care. So you have to involve the family members, how they will take care of the patient. The renal transplant patient, and how they will look after the home environment and how they will maintain the hygiene, and they need to be involved a part of the treatment program of the patient. So it is not only the surgery is important, it is also important to reduce the complications. As I said, you have to monitor the complication throughout. So you have to teach to the patient how they will see, what are the signs symptoms they will see, and how they will monitor their own rejection of that kidney grafting. So there can be complications to this renal transplant. So the first complication which occurs, that is graft rejection. Rejection means that is always a major risk of transplantation. What is the rejection means? The body recognizes the transplanted kidney as non-self. That means the body recognizes the transplanted kidney as a foreign body. So the immune system becomes active and they act upon the uh, transplanted kidney. So graft rejection is assessed by monitoring fever, malaise, elevated WBC, as I said, elevated WBC count, then graft tenderness. So all the time the patient is feeling tenderness, that is also worrisome. Then signs of deteriorating renal function, then acute hypertension and anemia, that also you have to C. Then hyperacute rejection if it occurs immediately after surgery. See, acute rejection. Hyperacute means if it is rejection occurs immediately within the 48 hours of surgery. Uh, so what it will be done immediately? The removal of rejected kidney is essential. So if it is found the rejection is rejection takes place within 48 hours of surgery, so the rejection kidney has to be removed immediately. Acute rejection, if the rejection occurs within 6 weeks of surgery, but maximum limit up to the 2 years. So from 6 weeks to 2 years, if it is rejection occurs, then it is called acute rejection. So high doses of corticosteroids, monoclonal antibodies is given for that. So chronic rejection, if it occurs slowly, months to years after transplant. Whatever, I mean, one patient can live for 10 to 15 years. Then after that, there will be rejection. Then it is called chronic rejection beyond 2 years. So for that also chronic rejection, for chronic rejection, you have to give immunosuppressive medication throughout lifelong. Then there will be urologic and vascular complications. The complications which include urologic and vascular complication, there may be an operation site. The complication like lymphocyl can be a pocket of lymph accumulation may be there. Then compression of the iliac vein causing ipsilateral leg swelling may be there. Hematoma may be there. Any injury, any surgery means hematoma may be a small vasculature. It has been left and bleeding blood can be accumulated underneath the tissue that can occur. That is hematoma can be seen. Then the infection and urethral stenosis or occlusion by clots can be seen also. So urine leak from the anastomotic site may occur in the early post-operative period or at the onset of post-transplant diuresis. So when the post-transplant diuresis goes on, there may be urine leak may be found. So then pseudoaneurysm secondary to infection may be expected. So arterial thrombus or venous thrombus could also occur. Then post-operative bleeding may occur when the small vessels in the renal ileum has increased perfusion. So that is also another complication can be seen. Then there may be hemodynamic instability. So there is a delayed functioning of the transplanted kidney due to prolonged ischemic time. So prolonged ischemia will occur. Why? There will be delayed functioning of the transplanted kidney. As I said, if it is a cadaver kidney, it will take time to function. But in most cases, from a living donor, the transplanted kidney start to function within a few hours, a few days. So this leads to intravascular volume problems. Then hypertension is another complication. So what will be if there will be hypertension? What will happen? Increased blood pressure. What will happen? It will damage the parenchymal structure of the kidney because of peripheral transfusion will be low. So hypertension, the etiology of hypertension can be post-renal transplant, maybe due to retained native kidneys the parenchymal diseases of transplanted organs, effects of immunotherapy. So for that reason, there will be hypertension will be another complication. Then renal artery stenosis, that can also lead to hypertension and weight gain. That is what it is very important. You will make a chart for the patient, how the patient will record, monitor the weight, and how the patient will write it, how the patient will record everything that you have to, I mean, urine output, everything you have to teach. And see, this is very important. After the surgery, how you counsel the patient, explain the patient related to the post-operative and home care, so that the patient will take care of himself or herself. The family members need to be involved in this treatment program of the patient. Otherwise, we only cannot manage. So that is what it takes a long sessions of counseling to the family members as well as to the recipient and to the donors. Then electrolyte and acid base imbalance. So this is also, as you know, only one kidney is functioning and another kidney is yet to function or may not be in function, may function in late. So electrolyte imbalance of hyperkalemia, hyperphosphatemia, and hyponatremia may persist or can be after exacerbated after renal transplantation. It can be aggravated. So surgical tissue destruction along with the impaired renal function increases the hyperkalemia state. Why there will be hyperkalemia? Because of this impaired, tissue destruction in the renal area, kidney. So after surgery, impairment of hydrogen ion leads to metabolic acidosis. Then there will be renal dysfunction. So renal dysfunction, as I said, recipients of cadaver kidneys with preservation. I just said how we do the warm ischemia, cold ischemia, harvesting of the kidney. So that takes a long hours, and the hours which is delayed in case of cadaver donor, if it is delayed beyond 24 hours, as I said, ideally it should be within 6 to 30 hours, but it is said beyond 24 hours, that means there will be delayed graft functioning. So as quick as possible, if you will get a cadaver donor itself, if you just transplant the kidney as quick as possible, then the graft functioning will be established yearly. So the renal dysfunction in the recipients of cadaver kidneys with preservation times of more than 24 hours may experience delayed graft function. Besides that also, there will be acute tubular necrosis. So acute tubular necrosis is a common complication and that may last from several days to weeks. So the same, complications you will get, and that's why it is important till the function of kidney and transplant kidney establishes. The patient will be supported with dialysis. From maybe may last from till the urine output increases and their serum creatinine and blood urea nitrogen start to begin to normalize. Till that, you have to support the recipient with dialysis. That is also important. So to avoid this renal dysfunction, the patient should be kept under hemodialysis till the creatinine level of serum creatinine, blood urea nitrogen is normal. Then infection. A patient with renal transplantation are very susceptible or vulnerable to infection. Why? Why there we talk about isolation nursing?
They are
Why you talk
given
about reverse barrier nursing?
That
Because
is all.
they are
and
already getting immunosuppressive drugs
Very
before.
good. They are already having high doses of immunosuppressive drugs. That's why they are very vulnerable to get infection or very vulnerable to, susceptible to any kind of infection. So that is why it is important to maintain strict reverse barrier nursing. All the healthcare providers need to maintain the sterile field and need to wear PPE while approaching to the patient. So that is very important. We have to see that, and the alterations in normal defenses. See, the patient is not having normal defense mechanism. So since there is alteration in normal defenses of the body due to surgery and the impact of ESRD, that is end-stage renal disease. Due to this end-stage renal disease, the defense function has been altered. The patient has received a kidney from another person. So that is why, and the patient is receiving immunosuppressive drugs. So that is why it is important to maintain this reverse barrier nursing, and patient should be kept under strict isolation. So other comorbidities conditions may be monitored, may be assessed, examined, and otherwise they may compound the effects of immune response, and the patient may get infection immediately. So coming to the while writing, this is all about the renal transplantation, how we take care, and what is the meaning of it, and what are the advantages. Why we go for a kidney transplant? Because we may the there is a chance of higher survival rate, and uh, this lifelong dialysis is a complex act, and it's a cumbersome and worrisome also. So the patient may undergo, um, instead of dialysis, lifelong dialysis, we can keep the patient. We can keep the patient. Uh, we can do the transplant surgery for the patient. Then next is how to write this nursing management. As I said, all together, how will manage, how will give counseling to the patient, how will share health information to the patient. So when you're writing if you get a question like write the management of nursing management of patient with transplant surgery. So by using nursing process, so how will write? The first thing it will come.
Nursing diagnosis, interventions,
How will write the nursing diagnosis? You tell me. The first thing you will write.
according to NATA diagnosis,
Hmm. So patient may be high risk for the infection.
infection,
First, in the post-operative period, you have to see that the patient may be risk
risk
for
for infection,
infection, risk for fluid volume deficit, risk for fluid volume overload, okay, risk for injury. So you have to tell, if risk for infection, what will be the nursing intervention to that? I
isolate the
just said a
patient,
diagnosis. People write
and
patient is
administer
risk for.
antibiotics.
Risk for means patient may be may have the potential problem. This is not the actual
yes,
problem. Now the
yes, sir.
patient is having infection. Patient may have. So the patient you write the nursing diagnosis as risk for infection. So what will be the nursing intervention?
Provide the patient in isolation room and strictly maintain the aseptic technique or sterile technique.
Okay. What is next?
Administer antibiotic timely.
Yes. So
Strictly
you have to
maintain
do the
hand hygiene.
maintain hand hygiene first. So all of you know what are the steps of hand hygiene? all 6 steps. Everybody
Hi,
knows.
Yes,
So
ma'am.
yes.
six steps of hand hygiene. You remember? I'll just give an acronym. What is that hand hygiene you will do? So everybody knows. Just remember acronym Suman K. Suman K, that is A stands for straight. Then straight, you have to rub the palm to palm. Then backside of the palm, that is ulta. S U stands for ulta. Then
Excuse me, ma'am.
pardon,
Can you share that in group? That acronym.
that acronym. Okay. So I'm just showing. See this acronym you write Suman K S U M A N K. So Suman K you just write. This is almost in Hindi. Straight, Suman S stands for straight. So after taking a foam of lather, you do the rubbing of palm, that is straight. Then you do ulta, both the hands. Then the mutti, you have to do the mutti. Then do the anguti. A stands for anguti. Then N stands for nakul, both way. Then K stands for kalai. This is very easy way to remember the hand hygiene aspect. As you know, if you are properly maintaining the hand hygiene, you are just curtailing the infection rate that is almost 90%. Then you have to maintain the uh, proper
And ma'am,
PPE.
along with hand hygiene, we have to maintain the 5 moments of hand hygiene also.
Yeah, 5 moments of hand hygiene you have to follow, and the steps of hand hygiene you have to follow. I mean, you need to keep
Excuse
in
me, ma'am.
mind. That is, pardon,
Ma'am, what is
hello.
A stand for?
A stands for
A is stand
anguti,
for in
thumb. Thumb. A stands for anguti, that is thumb. K stands for kalai, that is wrist. Got it?
Okay, ma'am. Okay, ma'am.
So that's maintain the hand hygiene. Then just see that uh, maintain hand hygiene. Then wear the PPE. Wear the PPE and as with the demands of the procedure. So when you are going inside the ICU and inside transplant patient, wear all PPE and then maintain the biomedical waste. That is very important, and also the cleaning of the environment, that is important. Maintain all sterile field in doing the dressings, everything. Maintain the hygiene aspects of diet the patient receives. So you just monitor, examine, and maintain everything so that the patient won't get any infection. So under the intervention, you will write each one of this act, like maintain hand hygiene, wear PPE, then restricted the visitors. That is one thing. All those who are coming, they should wear PPE and go inside to the patient. Then maintain the biomedical waste properly. Then maintain the hygiene aspects of the patient. I mean, the diet, everything what the patient takes. So these are all things you have to write down under the intervention. Similarly, if the patient is risk for fluid volume deficit, you have to monitor what? What will be the nursing intervention?
Monitor IO chart.
Very good. Monitor IO chart
Yes.
first. Next, what to monitor?
Signs of edema.
Then we'll monitor the
No.
weight.
I said risk for fluid volume deficit.
Sorry.
IO chart
We'll-
first step, that is true. Then what will be next?
Weight, we'll check daily monitoring for weight.
Daily monitor the weight. Then monitor the patient's serum urea creatinine, then monitor the blood urea nitrogen. So you'll get if the creatinine and all that is high, fluid volume is not maintained properly.
So
Okay,
there
so
should be fluid restriction,
pardon?
and there should be fluid restriction. Means per day patient should take 500 ml or
Yeah,
700
yeah.
ml.
Yes, fluid and restriction is there, but still you have to maintain for the patient whether by this patient is risk for overload or not, or any deficit is ready. Already there is a restriction. So you have to see the diet restriction also for the patient. As the patient condition demands, so you have to see a patient is not taking extra calories and protein, excess protein diet also need to be avoided. So these all interventions you have to write in under the nursing management. Then any risk for injury, since the patient is in on the bed and the patient is taking rest. During that time, you have to see that the patient should not be left unattended. If the patient is
Side
unconscious,
rails
you
should
have
be
to raise, yes, to raise on the side rails. All those intervention you have to mention. Also, you have to see that watch for any uh, in risk for fluid volume deficit. Also, you have to monitor the signs of symptoms of dehydration. Here also in risk for injury, in that nursing intervention, you have to monitor the signs of any DVT, deep venous thrombosis, any signs of thrombosis. Even you have to see that any type of lymphocyl or hematoma, anything in the site of operation, that you have to check or examine every day. So this is all about the nursing management, what you will do for a patient in the kidney transplantation. So any other thing you would like to ask? Regarding your this theory will be continued. Will take almost 12 session of theory part, and the rest of the theory you have to um, read yourself. Most more self study is uh, is there for this course. So only limited sessions will take. So whatever doubts you have, you just note down and write in the WhatsApp group we have already created, and will clarify all your doubts, whatever it is, in the next class. And then regarding practical, this theory will be done online, and the assignment which is given to you, you will download learning materials as I had said from that link. I had shared the link.
We didn't got the study material yet.
Pardon?
Study material we didn't got yet.
You didn't
Hard
get. You
copy.
will get it in by post. That's not our role. The central office will give. I think you will just download the soft copy.
Ma'am, please
Soft
share today's
copy.
soft copy which you have
Okay,
shown.
whatever soft copy
Before.
we have, we will share with you in the group, and you will just go through the sessions, whatever it has been covered to you. So that copy I'll send today, but you try to download all the
Ma'am,
copies.
hard
Soft
copy
copy.
when will come?
Madam, they'll send by post hard copy. But you do start writing. If you get the soft copy, you start writing the assignments and submit on time. I think 31st August is the last, both assignment 1 and assignment 2. Assignment 1 you have to submit by 31st July, and assignment 2 you have to submit 31st by 31st August. So maximum by
To
31st
submit
August.
assignment, we have to go
No,
Bhubaneswar
no,
or
no
by
need
post.
to come. No need to come. You have to send by post to the study center.
Okay, ma'am.
Okay.
Okay, ma'am, please share the today's study material.
Study material, whatever we have, we'll send you. The soft copy only we have, that I will send you, and you start writing the assignments. And for the practical
Ma'am,
sessions, you
the
have to
WhatsApp
come
group
to.
didn't add me.
Pardon?
Yeah, the WhatsApp group. Till now, nobody
You have
add
not
me.
been added.
Yes.
Or tell your friend to add. I think they are only the admin. We are not admins. So
Okay.
tell your friends or write your phone number in the chat box here. Who
Okay.
is the admin? Please take her number and you add it. Okay.
Okay. Okay, ma'am. Okay.
One.
Excuse me, ma'am.
Ah,
Ma'am, actually there is this BNS 31 and BNS 32.
yeah.
In each there will be two assignments.
Mm. Two
And which assignments
assignments.
we have to submit first? BNS 31 or BNS 32?
No, both all together you have to submit. BNS
Okay.
31 assignment 1, BNS 32 assignment 1, you have to submit by July 31st.
Okay.
If not
Then
also, all
okay.
four. I
Okay,
mean,
ma'am.
two, assignment
repeat,
1
ma'am.
and 2 of
Ma'am,
BNS 31. One by one, one by one.
ma'am, July 30.
No, no,
Yes,
July
yes.
31st. Assignment 1 you can submit. By August 31st, you can submit assignment 2. If you have not completed assignment 1 by July 31st, by 31st August, you submit all four. I mean, assignment 1 and 2 of BNS 31, assignment 1 and 2 of BNS 32. Okay.
टोटल
मैम
कितना करना पड़ेगा मैम?
चार
No,
है
no,
टोटल.
not जाना नहीं पड़ेगा. You just send by post. Courier से send कर देना. You send by courier. No
हेलो
need
मैम,
to come.
एक्सक्यूज मी मैम.
हाँ,
Ma'am,
tell me.
where to submit this assignment?
You
Actually,
submit this principal, College of Nursing. Just
एक्सक्यूज मी
write
मैम.
down principal.
ma'am, I'm from Delhi. Delhi. My center is in Delhi. So should I
Yeah,
submit to the
no
Bhubaneswar?
problem. You can send the assignment.
To the,
एक्सक्यूज मी मैम.
If our study center, see which one is your study center.
mine is Delhi Narayana Center.
मैम
So
माइन इज
you
कश्मीर.
submit there.
आई
Okay,
You
हैव
will
स्टडी
submit the
सेंटर इन
assignment
कश्मीर
there.
मैम.
okay. We don't have to submit to the Bhubaneswar Center.
No, no, no.
Okay, ma'am.
एक्सक्यूज मी मैम.
Promise. Till.
I have study center in Kashmir because I am from Kashmir.
Hmm.
In
So
Srinagar, I have.
studies, you have to submit your assignment near a study center.
Okay, ma'am.
So,
Ma'am, what about the practical? Practical, we need to come to the Bhubaneswar or there will be in the Delhi.
see if they are not actually, if I have to discuss to the regional director, if all have to come here,
Ah,
then you have to come by group. I mean, the number is big, so I have to make a group, small group, and you have to come at least for 14 days to do your complete your assignments, everything, practical records, everything. So you have to do duty here also. One thing is that we are not
Ma'am,
allowing to stay. I mean, you have to take your own rented house here to stay. We are
Acha,
not allowing.
there will be no
ma'am,
practical in Delhi. There will be no practical in Delhi.
In practical in Delhi, I'll talk to regional director. I
Ma'am,
don't know.
actually,
I have to
hello,
confirm it.
ma'am. Hello, ma'am.
Tell me.
We got in induction program. We got information that our practical exams will be in the respective study centers.
If it is in respective study centers, then
Yes, ma'am.
they will. I think they will give you the nearby study center. You can submit your assignments also. I'll
Yes,
give
ma'am.
you details of that after talking to them. If you have to come, you
Ma'am,
have to
please
come.
clarify about the practical and the examination center also, please.
Yeah, practical examination, if it will be done, it will be done as per your convenience. If you say we'll do 7 days, schedule, Then we'll give 7 days this month and next month 7 days. Then we'll start it from September. If not, also at a time, if you can come all together for 14 days, we'll schedule in that way. So as per your
मैम
convenience,
मैम
we'll do that.
मैम मतलब असाइनमेंट में क्या लिखूं? हम लोगों के पास तो कुछ स्टडी मटेरियल्स नहीं
क्वेश्चन
है।
दे दिया ना सर, तो क्वेश्चन डाल दिया ना।
ऑलरेडी
क्वेश्चन
अपलोडेड
तो
है,
it is in the
असाइनमेंट
group now.
ऑलरेडी अपलोडेड है और बुक्स भी
Okay.
ऑलरेडी अपलोडेड है।
मतलब जो सर ने
That
जो
WhatsApp
क्वेश्चन दिया
group.
है वही लिखना है, वही लिखना
हाँ
है
हाँ
ना
वही
वही
लिखना
स्टडी
लिखना
है,
में?
है।
वही लिखना है।
अच्छा अच्छा
जो
मैम।
क्वेश्चन दिया है ग्रुप में वही लिखना है।
A4 साइज पेपर में लिखना है।
A4 साइज में पेपर लिखना है and you have to leave margin for 1 inch. Listen to me first.
ओके
All A4 size
मतलब
paper you have to give margin in all
बोथ
side.
साइड मार्जिन या पूरा स्क्वायर?
All side 1 cm margin you can give, but
ओके
left side you have to give margin for 1 inch, so that we can write the comments for what reason you got less mark or more marks, like that. Whatever is the possible things the teacher will evaluator will write, they will write. Okay.
मैम मतलब भुवनेश्वर में जाके मतलब हम लोगों का जो रीजनल सेंटर है वहाँ पे जाके ही मतलब हम लोगों का असाइनमेंट देना पड़ेगा हार्ड कॉपी या हम लोग
No
को बाय
need to
पोस्ट?
come. Sending
नो नो
assignment, for
रेस्पेक्ट
sending assignment you need not to come. You send
मतलब
by courier.
कुरियर में
Only
सेंड
the
कर?
assignment mark will send to the regional director after evaluating your assignments. You need not to come. Only for practical you have to come to the study center. And for 14 days you will come. All the practicals at the end of the sessions, theoretical session, I'll just explain what practical you'll do as self activities, and supervised activities what is remaining, that you will do here, and that will be a 14 days program.
और एग्जाम मैम रिटन एग्जाम?
No, the exam, practical exam will be in continuation to that practical 14 days experience will do that. And
मतलब मैं
theoretical
पूछ रही
exam
थी
you
मैम
will
हम
appear.
लोग
Listen to me. Theoretical exam you will appear your nearby IGNU center. You need not to come.
मतलब
Nearby
भुवनेश्वर में
any
जाना
IGNU
है।
center, you can give your option and you will write your theoretical exam. हाँ.
मतलब मैं ये क्लियर नहीं हो रही हूँ मैम। मैंने पहले जब सर ने क्लास लिया था, पहले जब हम लोग के साथ इंट्रोडक्शन हुआ था तब सर ने बोला था कि रिटन एग्जाम और जो असाइनमेंट वो रिटन एग्जाम के समय भी आना पड़ेगा और जो असाइनमेंट है वो मतलब जो अपना अर्सी है वहाँ पे जाके सबमिट करना पड़ेगा। और
नहीं
अगर
नहीं
तुम
नहीं,
नहीं,
खुद
सर ने ऐसा
नहीं,
नहीं बोला। सर ने ऐसा नहीं बोला।
नहीं।
अरे मैं क्या झूठ
रिटिन
बोल रही हूँ ना?
एग्जामिनेशन,
मैं क्या झूठ बोल रहा हूँ? मैं
तुम्हारा
पहले
जो
दिन
अपना
जब किया
एरिया
था
है,
हम
सुनो
बार बार
मेरे बात,
पूछा था ना।
नहीं
तो मेरे
सुनो
को
मेरे
तो
बात,
नहीं नहीं
तुम्हारा
नहीं
जो
मैम वो
एरिया
ठीक
है,
है लेकिन वो बोल रहे हैं कि
guys,
मैं
listen to my
मेरे को तो मेरा जो कंफ्यूजन है मेरे को क्लियर होने दो ना। मैंने
हाँ,
सर से पूछा था, बार बार पूछा था, सर ने यही जवाब दिया था
तुम अभी
पहले दिन।
सुनो जो सर ने कहा, शायद सर ने नहीं सुना होगा। जो तुम्हारा जो एरिया में तुम्हारा घर जहाँ पे है, तुम्हारे एरिया में जो स्टडी सेंटर है, वहां पे रह के तुम थ्योरी
मेरा
एग्जाम देना।
भुवनेश्वर है, मेरा भुवनेश्वर है।
भुवनेश्वर में जो इग्नू सेंटर है, वहां पे जाके तुम थ्योरी एग्जाम देना। थ्योरी एग्जाम के लिए इधर नहीं आना है। Only for practical, you have to come here. Practical 14 days you have to stay, and we will conduct the practical examination at the end of the supervised activities
मतलब
completed.
मैं यही तो पूछ रहा हूँ मैम कि प्रैक्टिकल देने के लिए मेरे को भुवनेश्वर जाना पड़ेगा या कि दिल्ली जाना पड़ेगा?
why you are going to Delhi?
So, why to go Bhubaneswar? Why to go Delhi? You have to come to Berhampur for practical examination if your study center has been allotted this one.
मेरा जो सेंटर है वो भुवनेश्वर आ रहा है।
भुवनेश्वर में कहाँ पे है सेंटर?
मैंने
डीसी सेंटर।
बहरमपुर जो है ना, बहरमपुर जब
Ma'am,
भुवनेश्वर
this is hospital.
प्रैक्टिकल के लिए तुम्हारा जो सेंटर दिखा रहा है वहीं पे जाना है,
भुवनेश्वर है।
ठीक है?
हम लोगों का
भुवनेश्वर में
भुवनेश्वर दिखा रहे हैं।
I'll just ask sir कि भुवनेश्वर में whether they have made any center. I don't think. I'll
हम
talk
लोग
to sir.
मतलब कंफ्यूज हो गया है कि हम लोग कहाँ जाए,
नहीं,
भुवनेश्वर जाए या
कंफ्यूजन होने का कोई मतलब नहीं. You just write calmly, quietly. You write your assignment first. Send the assignment to respective study centers. Will evaluate, give the mark. If the practical schedule will be done, that will be done in the month of September, October, November. In these 3 months, we'll conduct the practicals. And if you have to
Ma'am,
come,
which,
you have to
in
come
which
here.
address we send our assignment? Please tell me the address.
Address you have to send here. That is Principal, College of Nursing, Berhampur. Write down
मतलब
that.
जुलाई अगस्त सितंबर और ये 4 मंथ
No,
में भी
July,
चल रहा है।
August is by that time you have to submit the assignment. For submitting assignment repeatedly, I am saying you need not to come to anywhere. You send by courier.
ओके
So just write down the address. Principal, College of Nursing,
Borhampur next.
Berhampur, BRHAM PUR, Berhampur, Ganjam, District Ganjam, GANJM, Ganjam, then Odisha. Write the pin number 76004.
76004.
Yeah. Write the IGNOU Study Center, Principal, College of Nursing, comma, IGNOU Study Center, 21 Study Center code 2137P. 2137 bracket, in bracket you write P. Give bracket, then you write P. Okay.
Okay. Ma'am, in the two assignments, per assignment, two blocks are consist 1 to 3 and 4 to 6. So how many assignments we have to bind? 2 or 4?
Assignments.
Total 4 assignments is there.
4 assignments are there, no? Assignment 1, assignment 2 for BNS-31, assignment 1 and assignment 2 for BNS-32.
4 assignment alag.
Ma'am,
Yes,
yes, ma'am.
4 and assignment alag.
Okay.
That means 4 booklet you have to prepare. Each assignment का एक booklet.
Okay, ma'am.
एक्सक्यूज मी मैम,
हाँ.
हेलो, वो
मैम
जो असाइनमेंट के लिए हम
Yes.
प्रैक्टिकल पेज भी यूज कर सकते हैं, वन साइड ब्लैंक और वन साइड जो रूल्स वाला होता है?
हाँ, यूज कर सकते हो
ओके ओके, थैंक यू मैम।
प्रैक्टिकल के लिए एंड थ्योरी के लिए.
मैम
033.
मैम मुझे कुछ पूछना था। हेलो
See, you will get your practical is separate learning package you will get. That is BNSL. BNS is the theory. L means that is related to practical. BNSL 33 and 34. That is related to practical. So you will get those copies also. In that, the last page of that booklet, you will get all the self activities, what is to be carried on, that will be written there. So whatever the self activities is written, that you have to do it in your own hospital. And the supervisory activities, what is chalked down there, that you have to conduct here in the study center. That you have to complete here.
मैम
Yes. Yes.
हेलो, मैं वेस्ट बंगाल से हूँ।
हम लोगों का जो रिटिन एग्जाम, ये सॉरी प्रैक्टिकल एग्जाम है, आपने बोला बहरमपुर में देना है। रिटिन एग्जाम के लिए भी हम लोगों को भुवनेश्वर आना है, क्योंकि
नहीं
हम
नहीं
लोगों का नियरेस्ट स्टडी सेंटर, रीजनल सेंटर कुछ भी है वो भुवनेश्वर ही है। तो रिटिन एग्जाम के लिए वहाँ कितने दिन ठहरना पड़ेगा? दिसंबर को रिटिन एग्जाम
नहीं,
जो है,
रिटन एग्जामिनेशन के लिए तुमको भुवनेश्वर नहीं आना है।
वेस्ट
वेयर आर यू
बंगाल के
स्टेइंग?
कोई भी
वेयर
स्टडी
आर यू
सेंटर पे
स्टेइंग?
देना पड़ेगा।
वेस्ट बंगाल कोलकाता।
नो, वेस्ट बंगाल का किस जगह में?
वेस्ट
मेरा
बंगाल का
कोलकाता
झारग्राम
में
में है, मेरा
In
झारग्राम
West
है।
Bengal, there is no nearest study center for decision course.
हाँ,
No,
Yes, yes,
डिसीजन के
there
नहीं
is
है
a
तो
there
क्या
is
हुआ?
a
एनी फॉर
center
एनी
in
अदर
Kolkata.
प्रोग्राम इज देयर
ए,
एनी
একজন
should
বলো,
स्टडी
একজন
सेंटर?
বলো, একজন বলো, একজন বলো।
इग्नू का एक
কলকাতায়
ब्रांच
আছে
है। हाँ,
হ্যাঁ কলকাতায়
कोलकाता
আছে
में
এক্সাম দেওয়ার জায়গা।
का कोई
কলকাতায় আছে
একজন
আছে।
বলছি, একজন বলছি থামো।
There must be some study centers in Calcutta in different colleges. You just ask. There must be some study center in general educational colleges. You find out.
Yes,
So
my
you can
study center
give
is
the
there, but
theory exam there.
ma'am, study center is there, but in that college there is no decision course.
Study center नहीं होना चाहिए वो theory exam के देने के लिए. You have to have a only study center. Whatever the course they are having, that doesn't matter. You just
Okay,
give
ma'am.
your
Okay, ma'am. Okay, ma'am. Got
nearest
the
study
point.
center
मैम
for
प्लीज
appearing theory
रिपीट, प्लीज
examination.
मैम वन टाइम रिपीट कीजिए। ये मतलब समझ में नहीं आ रहा है। हम लोग वेस्ट बंगाल में जो हम लोगों का इग्नू है वहाँ पे तो
শোনো
हाँ
ম্যাম বলছেন যে ইগনোতে ওখানে যে এরকম মাস থাকে ডিসিশন কোর্স থাকতে হবে, এনি কোর্স যাই কোর্স থাকুক না কেন, এটা যদি ইগনো সেন্টার হয় সেখানে গিয়ে আমরা ডিগ্রি একদম দিতে পারি।
हाँ,
বুঝতে
theory
পেরেছি?
exam
কবে
হবে না,
হবে? ডেটটা কবে পাবো?
শোনো না,
but
ইগনিউ সেন্টারটা বিকাশ ভবনে আছে, কিন্তু ওখানে গিয়ে তাহলে কবে জিজ্ঞেস করতে হবে আমাদের যে আমরা থিওরি এক্সাম
তুমি
এখানে কোন
যখন
কলেজে
যখন যখন
তুমি
তোমাদের
যখন
এক্সাম এক্সাম যখন হল থেকে বুক করবে তখন তুমি তোমার এটা বুঝতে পারবে। তোমার নিয়ারেস্ট লোকেশনে তুমি নিজস্ব পোস্ট করবে, পোস্ট করলে তুমি ওখানে
এক্স্যাক্টলি।
এক্সাম সেন্টার পাবে, এক্সাম দিতে পারবে।